Hi, my name is Liliana Avignoni. I am an RPN to BSCN nursing student with Nipissing University, and this is my concept health-based assessment. I'll start by doing a 360 view of the room. Okay. For this purpose, I'll be using my sister as my patient. Can you state your name, please?
Marla Avignoni.
Okay, and do you give consent to be in this video and to be recorded?
Yes.
Okay, perfect. Okay, so I'm going to start off by asking you a couple questions. First things first, can I just check your wristband? Can you tell me your first and your last name?
Marla Avignoni.
And and your date of birth?
June 8, 1998.
Okay. Do you have any allergies?
No.
Okay, so I'm just going to ask you a couple questions first. What brought you in today?
I have been running for the last 2 years, and I noticed that at the end of my runs lately, I've been having chest pain and shortness of breath.
Okay. Do you have any past medical history?
No.
Okay. Do you have any family past medical history?
My dad has heart disease.
Okay. Do you take any medications?
Just multivitamin.
Okay. And you said no allergies. Perfect. Okay. So for the purposes of this video, we would usually take vitals now, so we don't have that here, so I'm going to state some vitals. So for you, we'll say your vitals are 118/78 for your blood pressure, your heart rate we'll say is 68, your respiratory rate we'll say is 16, your O2 saturation is 98% on room air, and your temperature is 36.0 Celsius. Any questions about your vitals?
No.
Okay. So I'll talk to you about a little bit about what we'll do. So right now we're going to just do an assessment. So I'll be visually and physically assessing you with your consent, if that's okay?
Yes.
Okay. So I'm going to start off by doing a visual assessment on you, but I'm going to ask you a little bit more about what you said brought you in. So you said while you've been running, you've been experiencing a little bit of shortness of breath and chest pain.
Mm-hmm.
This is happening at the end of your runs?
Yes.
Okay, so with the shortness of breath, how's that? Can you explain a little bit about that?
I feel like I have to keep catching my breath and taking deep breaths.
Okay, and that's at the end of the run?
Yeah.
Okay. Do you find anything helps alleviate it or helps with it?
Sometimes if I just slowly walk or do some deep breathing.
Okay. Okay. And how long is that happening for? When it's happening?
About 10-15 minutes.
Okay. And this is the first time this has happened to you?
Yes, it's been happening the last 2 weeks.
Okay. And same thing goes for the chest pain. So let's talk about the chest pain. So for shortness of breath, we normally don't use a scale, but let's say we're using a scale 0 to 10, 0 being no shortness of breath at all, 10 being the most shortness of breath you've experienced. During that time period you were experiencing the shortness of breath, what would you rate it?
About a 6.
Okay. And now to the chest pain. So with chest pain, just can you tell me a little bit more about it? Where are you experiencing it at the time?
I feel it in the center of my chest here, and it just feels like squeezing and really tight.
Okay. Does it feel dull or does it radiate anywhere?
No.
Okay. And for pain severity, we'll use the pain scale again. 0 being no pain at all, 10 being the most severe chest pain you've experienced. At that time, what would you rate it?
A 6 also.
Okay. Okay, so do you find anything helped with it?
Just walking or taking deep breathing, drinking some water.
Okay, and how long would you say that would last?
For 10 to 15 minutes.
Okay. Makes sense. Okay, so now we're going to go a little bit into a physical exam. So I'm going to do a respiratory assessment as well as a cardiac assessment as well as a peripheral, so your pulses. I'm going to do a little bit of that. So I'm going to listen to all of your heart rhythm and your heart rate and your lungs, okay? So we're going to start with respiratory. The very first thing that I'm going to do is, just by looking at you, I can tell your airway is patent, you're talking normal, you're oriented. I don't see any concerns there. But what I'm going to do is place my hands right under your rib cage at the base, and I'm going to ask you to take a deep breath in and out, and I'm going to check the expansion of your ribs, if that's okay with you.
Yes.
Okay. So deep breath in and out. That's good for interior. Now we're going to do your posterior, so if you could just turn around for me. Perfect. So we're going to do the same thing. Deep breath in. Perfect, okay. All right, so that's good. I noticed symmetry on both sides. Your expansion was equal, normal, bilaterally, so that's good. I didn't notice you using any accessory muscles at the time or any barrel chest, nothing noted there. Did you feel any pain?
No.
Okay, that's good. Also during any of this, if there's any concerns or you feel uncomfortable, you could just tell me, we can stop, okay? Okay, so now what I'm gonna do is listen to your lung sounds, okay? So I'm gonna auscultate with my stethoscope, and I'm gonna place my stethoscope in a few positions, and you're just gonna take a deep breath in and out each time I move it, okay? All right, so I'm gonna hand hygiene. Okay, and then I'll warm my stethoscope because it's cold. Okay, I'm just gonna move your hair, sorry. Okay, so I'm gonna start at the apex of the lungs, going to the base of the lungs. I'm just gonna go underneath your breast here. So I'm gonna go back here. Okay, so your anterior side sounds normal, so no adventitious sounds, which is abnormal sounds. So no crackles or wheezing. The only thing I noticed was some diminished lung sounds at the base of your lungs, which can be quite normal with shortness of breath. But any pain or discomfort during any of that?
No.
Okay, so we're gonna check the posterior side now that we did the anterior. And go into ladder motion here, so I'm just gonna move your hair out of the way. Okay, it's the same thing. I'm going to start at the apex of the lungs, and then we'll go to the base. So your posterior side also sounds normal. No adventitious sounds, no crackles, no wheezing. Same thing, just low diminished sounds at the base of your lungs. Any pain, discomfort during any of that? Okay, that's good. Okay, so the next thing I'm going to do is go into a cardiac assessment. So you said past medical history on your father's side, our dad's side, has cardiac issues. Okay, so I'm going to listen to your heart now. So same thing, but I'm going to do the front. Okay, so we're going to start, I'm just going to touch on this second intercostal space here. Okay, going to the right side, the aortic valve. This is in the right internal border. And I'm listening for S1 and S2 sounds, which is the loud dub. Dub is S2, which is normally heard louder, which is a normal sound, and that's what I'm hearing now. Staying in the second intercostal space. Going over to the pulmonic valve, which is the left internal border. Going down to the third intercostal space, Irv's point, staying in the left internal border. Going down to the, just under your breast here, fourth intercostal space, which is the tricuspid valve, staying in the left internal border. And then the mitral valve, which is the fifth intercostal space, and this is in the midclavicular line. So all heart sounds and right rhythm sounds normal, matches your vital sounds from earlier, so that's all great. No concerns there. Did you find any discomfort, any issues there?
No.
Okay, no extra sounds or anything like that were noted during that, so that's all good. While I'm doing this, I've been assessing your skin. So your skin color matches your ethnicity. It's pink, no discoloration, no scars, no cyanosis noted to your lips or your nails, which is blue discoloration. Usually when there's low oxygen, that's where you'll notice the first signs, is your lips and your nails, which I did not notice, so that's good. So the last thing I'm going to go into is your peripheral pulses. So I'm going to check from top to bottom, so your carotid all the way down to your feet, okay? So I'm going to start on one side, and I'll go bilaterally to check symmetry, okay? Carotid artery. Okay, going to check bilaterally for symmetry. Good. I'm going to check the brachial, the inner elbow. Perfect. Checking bilaterally for symmetry. Perfect. Now we'll check radial, which is the inner wrist. Okay, gonna check the other one, bilateral symmetry. Perfect, so that's normal. Okay, next one is your femoral, which is in your inner groin. Are you okay with me checking it? Okay. Okay, let's check bilateral symmetry. The next one is your popliteal, which is underneath your inner knee. So just gonna check here. Okay, again, checking for bilateral symmetry. Okay, so now I'm gonna check your popliteal, which is your inner ankle. Just gonna roll that down. Your pulse, which is the top of your foot, dorsalis pedis. Okay, so those are all great. All pulses were strong, normal, symmetrical, no concerns there. While I was doing that, I was checking your legs for symmetry, for edema. No noted edema. Edema is just swelling in the legs. So no cyanosis or scars. No issues there. I didn't notice anything there. Okay, so any other concerns? Any questions you have for me?
Is there anything I need to look out for while I continue running?
That's a good question. So I think what I would do is, obviously I have to bring this back to the medical team, which is what I was just about to get at. So I'm going to bring this back to the medical team. We'll discuss all the findings I found. And I don't see any issues right now with your airway, your breathing, or your circulation, but I do want to discuss with them further, come up with a plan, and then get back to you. But for right now, I would suggest maybe taking it easy, not running as much, or if you can, if you are running and you find you're having those same issues, that maybe just slowing down for a little while, either stop, see if you need to seek help, either from somebody who's around or going down to the emergency department. So that would be best. Otherwise, I would suggest just waiting to hear back from your team. Any further questions?
Nope.
Okay, so I'll hand you your call bell. Thank you. My name is Liliana again, and I'll be your nurse. So I'll discuss with the team, and then once I do, I'll get back to you. But if you do have any concerns, just feel free to press the call bell, and then I'll come. And anything you need, I'm here.
Thank you.
Welcome. Thank you.